had more than 430 attendees to our events and more than 30 outstanding speakers, ranging from students to academic faculty to company employee and to clinicians, testifying the interest for these topics. I think the event was a great success, testifying how health data science is a necessary transversal field of research with a huge potential in improving patients' health.
International and European, especially collaboration, it's really important because when we think about large-scale biobank and data set, we need to be able to generalize the results that we found in each country, in each biobank, across other European countries. So we need to collaborate so that the model that we build in one country are useful at the European level. And to do that, we need to harmonize the data better, and we need to create a network where this model can be transferred and tested in a more efficient way.
Very excited to be at the Politecnico di Milano today to talk about artificial intelligence. And the reason I'm so excited about using AI is to solve real-world problems. I often call this the reality-centric AI agenda. AI will really be transformational in many fields, including the two fields I'm most excited about: medicine and healthcare, and education. And with the emergence of large language model agents, we have an opportunity really to transform these two areas and bridge the gap between the world of medicine, the world of education, and the world of AI.
Artificial intelligence and deep learning will help a lot the analysis of the medical images and all the information available on the patient to provide a better diagnosis, a better prognosis, but also to build a digital twin of the patient that can be used to better plan and better control the therapy of the patient.